Welcome, everyone, to A Mexican Crossing Lines with your hosts, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM, KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. And tonight, I'm going to focus on the reopening, what's going on with the reopening. And the title of my show is Ready or Not, Here We Come. Because regardless of whether or not we have met the metrics set by the CDC, by the Trump administration task force, or flattened our curve, dropped in our number of deaths for 14 days consecutively in the states that are reopening, have an adequate amounts of tests to do testing of employees going back to work, especially of frontline workers, etc. Or the fact that we do not have the capacity as of yet to do contact tracing effectively, to monitor where people are going, what they are doing, and to be able to notify, quarantine, as the president put it, to put out fires where they are going to arise. We are reopened in many places, including places like Iowa and North Dakota that never really shut down. And we're going to examine the effects of all of those things, and especially today, I am going to focus on workers because we're getting a lot of mixed messages for those who are going back as essential workers, as mandatory workers, as meat plant workers. Those who are being told that they have to go back or lose their homes, lose their livelihoods, or their jobs. I'm going to be speaking to those workers today. I have a message of hope for them. And I'm going to be covering what's been going on with regard to people using masks and following social distancing guidelines in our reopening efforts. All of that on tonight's show, as well as the story of a Los Angeles frontline worker who has a harrowing account of what it takes in Los Angeles County to get a test, to get treatment, and to get quarantined after you've been exposed to COVID. All of that I'm going to bring to you on tonight's show, but first I want to thank everyone for following our pages, for supporting our work, and Duke can tell you all about how to do that.
That's right, and thank you for joining us tonight. It's a beautiful rainy Monday up here in Minnesota, North Dakota. Hope you're doing fine. If you want to get a hold of us, there's many ways to do it. You can call and leave a message on the message line, and you can have about up to 3 minutes to leave a message. It's quick and easy. Just dial 701-566-0917. That's 701-566-0917. You can also email us, Cindy at kpppfm.com, and Duke at kpppfm.com. You can also find us on social media, 88.1 FM Fargo Moorhead Radio, Mexi-Can, and the People's Press Project. You can go to our website at kpppfm.com, look around, look at some of our older stories and our older podcasts, and also support our work by going to the donate button and making a tax-deductible donation to our organization so we can continue doing what we're doing today, bringing you the news, perspectives, and something completely different. Also, you can go to YouTube. Our YouTube channel is Duke1517. We're doing simulcasts where we're live streaming on Facebook and YouTube at the same time. So that way we give our other audiences, that don't use Facebook, opportunity to see the shows. And we interact with both. We have a wonderful moderator that's going between the two platforms and watching your P's and Q's and making sure people stay on task and stay connected to the topic. And it's going to be a really good show tonight. We have a bunch of things we're bringing up. We've been doing this daily now for, we used to do about three times a week we did shows, but now we're doing them daily. And we've been doing that for about a month and a half. A lot of work goes into each one. We try to bring you the most current information that we can. And, we just hope that is beneficial for you. And we want you to invite your friends. So, please share it. Please take this and share it. On YouTube, you share a link, and people can go to that. They don't have like a share button, but you can also like it and hit the little bell so you'll get notified when the shows go on the air, basically. And those of you driving around Fargo Moorhead, we hope that you listen to our programs. We also have music. We have a new show that's going to be coming up this Friday. All sorts of variety that keeps on coming and coming and coming. So very much welcome and have a great show.
Also, I want to give a shout out to Lily V. Thank you for your $20 support donation to our work, keeping independent media speaking on your behalf, on behalf of the people, is more important now during the pandemic than ever, because it is only through the reporting of independent journalists bringing you the real stories that you're going to find out what's going on here and around the globe. In fact, I'm going to be bringing you some very interesting reporting from Mexico. Mexico coming up from our friends over at Border Network News. Oscar El Blue Ramirez bringing you information from the border city of Juarez as well as Tijuana. Now also reporting in the United States with America's Voice News, as well as Border Network News. All of that information is going to be coming up. And here is what the world looks like today. These are our numbers today. We have total confirmed cases of 3,578,301. Total deaths right now around the globe, 251,059. We have tested over 7,285,000 people here in the United States. Let's look at our U.S. total numbers. We've got 1,211,838 cases as of this very moment. 69,709 deaths. Boy, do you remember back when we were told that we might reach around 60,000 deaths?
Yeah.
In total?
And that happened real quick.
We are already past that number. Our president is now saying that this number could go as high as 100,000. This is very distressing when we think about the numbers of people that could get reinfected as people are reopening their governments. What does it look like in the state of Minnesota and North Dakota?
Minnesota's been having quite a hard time because our numbers are jumping, our deaths are jumping. It's just really surging, and yet the governor wants to keep the state closed, for another 2-3 weeks, which I think is good. We are at 6,228 confirmed cases, and 395 deaths. And our Clay County, where we live, 169 cases and 13 deaths, just in a small county that we live in way in western Minnesota. Now in Fargo, Cass and Clay, Cass counties and Fargo, North Dakota number keep going up. They go up. I mean, they went up 34 in one day, which is just today, and they've been going up in about 30s, 40s, like every day since.
More than half of the cases are in just one
Yep.
county for the whole state.
For the whole state. 51% of North Dakota's cases are in Cass County. That's the county that we live in. And they've tested 34,000 people, and they've had 1,225 positives. But also look at who has recovered. Only 540 people have recovered.
Where's the rest of them?
They're all still sick. They're all still positive. I don't know what it means by recovered. I guess I'd have to go. And here's another tidbit. They were going to do testing at the Dome, Fargo Dome, which is one of the biggest buildings we have around here that you can fit a bunch of people in, and also big, huge parking lots. You can have a lot of people driving through. Mm-hmm. They've canceled the test today. They're supposed to test from 1 p.m. to 5:30 at the Fargo Dome. And it was canceled. The cancellation is due to a shortage of testing supplies at the North Dakota Department of Health Microbiology Department.
That's really upsetting, Duke.
Yeah, it is.
Because this testing that was taking place at the Fargo Dome this weekend was for frontline workers, for essential workers all throughout the country. As people are reopening, Dr. Fauci, the people on the task force, the governors of the state have all emphasized, the governor of North Dakota has emphasized the need to test employees to make sure, especially that people that are going to be in close contact with each other, especially frontline workers, be tested. We haven't even gotten all of our people working with the elderly and in the medical setting tested.
Right. I know. It's just doesn't make any sense. In fact, this one, I'm not sure what to make of it. That they don't have enough tests at the state, and yet they're encouraging all this testing. I mean, I get suspicious. I don't have all the facts behind it, but that's something that just came out in a news source today. And I wanted to also say thank you, Sophia. Sophia made a $20 contribution on our YouTube Super Chat. If you're on YouTube, you want to support our work, go right down to the little button, make a donation to our organization today.
And she says, support independent reporters.
Yes.
Thumbs up, both of the thumbs up on that one.
Oh, yeah.
Let me tell you what my assessment is. I know that most of the people that listen to my program know that I am a paralegal by education and training. And you may have heard me talk about the fact that I worked in a variety of fields. The majority of my time was spent in administrative law, specifically dealing with workers' comp and Social Security disability. And let me tell you what I learned in terms of workers' comp, Social Security disability, veterans benefits, heck, any type of insurance, heck, any type of benefit. Whether it's unemployment benefits, I also worked in that arena as well. You know what I learned? Insurance companies don't like to pay out benefits. You know what else I learned? Most of the time, when there is a service, a benefit, or something like that people can access, any kind of government service or benefit that people can access, there is a lot of jumping through hoops in order to access them. A majority of people are denied the benefits or denied the access. How's it going for most of the people trying to sign up for those SBA loans for the unemployment, right? Most of the people that are going back to work in states that are reopening really didn't have any other options because they tried and failed at unemployment benefits. The frustration levels, the anxiety are extremely high for folks that need to figure out how they can pay their bills, how they can avoid their homes being repossessed, how they can avoid being evicted. What did I tell you was taking place yesterday in North Dakota? evictions.
Oh, yes. That's right.
Evictions were taking place yesterday in North Dakota per a post on social media. And in this post on social media, why do we have this graphic up?
I don't know.
In this post on social media, they were talking about people getting evicted in Fargo. And Duke asks me, well, didn't we have a Supreme Court decision that said that people can't be evicted right now?
Yeah.
Not anymore. We have rescinded, we have changed all of those things when we decided we're going to open up all these businesses and we're going to pull back the quarantine, stay at home, stay in place, shelter in place orders in most of the country. So folks are going to need to go back to work. Folks are going to need to go figure it out because the protections of not getting your utilities cut off, of not being evicted from your building, those are gone.
Mm-hmm.
And people are very scared. So they know that their choices are figure out how you go back to work, if your job is even there anymore, or become homeless, or become destitute. And in the midst of this, we are learning, I am learning, that there are a number of people that are struggling on all of the fronts. People that are being told to go back to work when they can't. In cases where they know they have symptoms of COVID and could be making other people sick and for whatever reasons can't access a test. And I'm here to tell you that I've heard employers tell their employees, you don't qualify for this benefit. You don't qualify to file a claim under workers' comp. You don't qualify for unemployment. If you do this, this is what will happen to you. And it's all lies. It's a form of intimidation. It's a method to discourage people from accessing what they deserve. And then when they go and apply for these things, when they try to access them, there will be another hurdle that will make it incredibly difficult, if not impossible. But you have to keep trying. What many of you don't know is that if you keep trying, if you keep applying, if you wait it out, if you appeal and you keep appealing, the likelihood that you will actually get and qualify for those benefits in the long run are pretty good. Better than 50% good. But nobody is going to tell you that, least of all the governors of the states of places like Iowa, telling folks in the meatpacking industry that if they don't go back to work, they won't qualify for unemployment benefits. Basically letting them know that they are required to go back to conditions that are not following CDC guidelines of distancing, of protection, of PPE, of testing, or any other safeguards that would keep the rest of the workforce in these meatpacking plants from getting sick and or dying. Because, oh, by the way, did you know that the majority of the people that are dying are black and brown people?
Yeah.
Poor working class people. The majority of the people that are dying are those that have all of these comorbidities, this extra danger because they have asthma or diabetes or something else. Maybe they're old. And I'm here to tell you that you need to protect and preserve your life. And also, don't believe the hype, because no governor of any state can assess from a pulpit somewhere whether or not you qualify for unemployment benefits, especially, and let me tell you this particular thing you need to hear and you need to tell your friends about. If there is a dangerous hazard in your work environment, I think a pandemic that kills you qualifies.
True.
If there is a hazardous work environment, It has been pointed out to the employer. They are aware of it. It has already killed other people, and they do nothing to protect you but tell you and order you to go back to work without the necessary precautions. That's a hostile work environment. That's a dangerous work environment, and there isn't anybody that can stop you from protecting yourself. If you quit in a situation like that, it's not even considered like you quit. You left a hostile work environment that could have killed you. That's what you did. You protected your life. And it is completely, totally okay for you to do that. Let me tell you something else I see coming down the pike for workers, for people. I knew the moment I saw people defending their rights to go out, to not wear masks, to go into stores where masks are required for the protection of the essential workers that are running the tills, that are stocking the shelves. And that was met with derision and anger. I could tell, there is a certain percentage of our population that not only feels that this virus isn't serious enough for them to have to shelter in place or wear a mask, they feel entitled to get other people sick. It's your responsibility to keep yourself away from them and healthy. It's your responsibility to hide yourself in your home, even if you have no one to bring you groceries, even if you have no one to bring you medicine. They don't care. They're going to assert their right to go out in public, to go into establishments and businesses without a mask and go up and talk to you, insult you if you ask them to wear a mask, and even violently attack you if you tell them that they have to follow rules for the protection of other people. And what that forbears for all of us is that we, as a community trying to survive in a pandemic, are going to have to prepare ourselves to meet a world of people that don't want to acknowledge that this virus is deadly and that they could be spreading it. That not only do not want to acknowledge that this virus is deadly and that they could be spreading it, but that they may know they have it and want to exert their right to continue to infect other people, even if they know they're positive. That will deny the right to be tested. In fact, will deny medical workers or law enforcement the ability to test them because it violates their constitutional rights to privacy to not find out whether or not they're COVID positive, because there's a certain sector of the population that does not want to know. They don't want to know if they're positive or not, because that would mean they'd have to stop working. They'd have to shutter down their business. They'd have to test their employees, etc., etc. You know where this is going.
Mm-hmm. Yep.
And it's already happening. I'm about to show you the signs. Let me start with this couple in Iowa, been married for 3 years. That's them and their dog Bear in the picture. The gentleman in this picture, if you scroll down, you see their names there. Oh no, I guess I cut them off. But this couple in Iowa, and this was a story in USA Today that has kind of made national news. The headline is, "It's a nightmare. First denied testing, twice denied ER admittance. Iowa man dies of COVID-19. In their life, Kyle Brown and Pamela Denon deserved more time together. They had been married for 3 years. The couple from Marshalltown, Iowa, which is a very small town near where I grew up, Duke, in Muscatine.
Yeah. Okay.
Both got sick. They just celebrated their 3-year anniversary in February. And about 2 months later, in the middle of April, Kyle, after his maintenance shift as a technician, began to feel ill. 12 days later, he died of COVID complications in a Des Moines hospital. But during those 12 days, from the moment he started to get sick until the day that he died of the novel coronavirus, his symptoms rapidly deteriorated his health. He drove himself to the emergency rooms in his town in Marshalltown, as well as in a neighboring town in Newton, Iowa. Both times he was sent back home, even though nurses told the couple over the phone he needed treatment. Denon, his now sick widow, said it's hard not to wonder if he had been taken seriously earlier. If they had intervened sooner, would his lungs have responded better? Could his life have been spared? No one will ever know that. I think deep down in her heart, she thinks that's the case, though.
Yeah.
On their fifth trip, to Unity Point Health in Marshalltown, he was admitted after his blood oxygen levels dipped severely. At the end of the week, the ambulance took him to the Iowa Methodist Medical Center in Des Moines. Back at home, Denon, his widow, started to experience symptoms of her own: dry cough, frequent interruptions in her interview with the Des Moines Register when she talked about this, quarantining, unable to grieve the loss of her husband with her family and friends. You can just imagine how horrible this would be to lose someone in this way. But what is even more disturbing is that this man couldn't get a test, couldn't get treatment. And this isn't something that is only happening in New York, because we've heard plenty of that, or in New Jersey, or in these hospitals that have been overwrought with people that are sick. This is Iowa. This is the heartland. This is one of those states that never closed, that's still open, that's sending their workforce back to their work. Finally, over this weekend, we saw a town hall with the president, Mike Pence, and the Treasury Secretary, Mnuchin. It was very heartening to me to finally see Mike Pence wearing a mask at an event that he went to after he got the criticism for not wearing it at the Mayo Clinic. I think the vice president did a very good thing, leading by example, showing others in this country, especially Trump supporters, that it is important for you to protect your health and the health of others. And he also said during the town hall, when asked about why he hadn't worn a mask, that he should have. And that was the best answer he could have given.
Yeah.
He should have worn a mask, and so should you. Let me show you some of the responses to mask wearing in our local community. We have Dairy Queen in Moorhead, very popular, opens every year in March. Regardless of the snow, there's always a line.
That's right.
And of course, when it opened, there were a lot of people that have been going to the Dairy Queen ever since it opened. And here is a post from a local that went and stood in line to get their soft serve. I got walk up out at Dairy Queen. Notice the mask. I can't eat ice cream with a mask, but I wore it to the window out of consideration for the young people serving me. Me and my kid were the only ones wearing a mask. Come on, people, respect those serving you. They don't need the germs of every person speaking loudly into the window all day long. It's not fair to them. Wear your masks to order. You aren't supposed to be eating in the patio anyway. Go to your car, take your mask off, and then eat. It's simple, and it's considerate.
Yeah.
Here's another post about having respect for others and wearing a mask. This was posted by a local person They said, just so you know, I still care about you and will do what I can to protect you, even if you don't feel the same about me. A venture to the grocery store yesterday. Mask on despite being virus free. Never know who I might bump into. I'm in the minority. 25% mask, 75% unmasked. I know that the unmasked and I have a similar concern, a desire to get back to normal ASAP. Masks are not pleasant to wear, but there's a psychological piece when you wear them that we're all in this together. Masks are now a culture of shopping, impacting consumer confidence. Return to normal is delayed when some customers don't feel comfortable or safe while shopping. For my masked friends, see you at the Costco. Masks are mandatory there.
Oh, yeah.
Right? Yes, they are mandatory there. For the rest of you, I still care about you and those in your life that may be older or have underlying health concerns. For them and for you, I will wear this stupid mask. Take a look at the mask they wore. Here's a picture of the mask. Oh, I guess we don't have it in there.
There's no
That's
picture.
fine. That's cool. I thought they had a pretty cool looking mask.
Oh, yeah.
Now here is one of the many responses I saw to wearing masks in our community of why they won't wear a mask.
Okay.
This person says, I choose not to wear a mask.
The stores that force you to wear a mask will not be getting my business until that policy changes.
Social distancing. Do it. You stay healthy. No need to wear a mask out in public. However, if you choose to wear one, I won't judge you. And along those lines, I expect not to be judged by others for my choice not to wear one. You're asking me to wear a mask because 200 people out of 270,000 are sick? Of those 200 people, 190 of them are staying home. Let's just say I like my odds.
Oh.
The chances of me bumping into one of those 10 people in 14 days are the same as me getting struck by lightning once in 10 years. By maintaining social distancing, you won't get sick. In my opinion, they should increase social distancing to 10 feet. A cough, a sneeze only travels so far. Wearing a mask only gives people an excuse to get closer to each other. If you put a person in the dark room with a mask on and turn on fluorescent lights and have them sneeze, you'll see the mask does very little to prevent the spread. Instead of the cough going mostly horizontal, it instead goes mostly vertical. So, social distance, wash your hands, don't touch your face. You know the things your parents told you when you were growing up? That's how you stay healthy. Mask does extremely little to prevent the spread. That's my opinion. Come on, common sense equals survival. I now await the backlash. I don't think they got a lot of backlash. That's the picture that went with the post that I was asking for the picture of the mask.
Okay.
So that's over with and done. We don't need that anymore.
All right.
So what do you think of the guy that says no mask? He says only 200 people out of 200 and some thousand.
I keep hearing people are doing that. And in fact, it's almost what the governors are doing. Is it's not everybody. It's a small percent. They're expendable. It's a whole expendable argument once again that it doesn't matter that people are dying and that we've never had people die like this. We've never had our hospitals full. We haven't had something that people catch and they can die 2 days later, or they have injury to their lungs, or and some people aren't affected at all. But it's like that shouldn't make it that we just don't care that this is going to happen to people, and then we can do something about it. We can prevent it. It's a preventable disease that they just don't take that into consideration when they're talking like that.
I think that, up till this point, we've been having people that are going out there, and most people have been staying at home. But now that things are reopening, a lot more people are going to be out and about, which is going to mean that the chances that you're going to run into someone that is asymptomatic, which is about half of the people that get this, they're asymptomatic, just goes up and up and up. And there are people who are very insensitive when it comes to being told that there are rules.
Mm-hmm.
Businesses have the right to refuse services to whomever they want for whatever reason they want. We still believe that in America, don't we?
I hope so.
I mean, there's a lot of people out there who believe that you shouldn't have to bake a cake for someone if they're gay, who don't believe that they should have to give out contraception if they're a Christian business. What if you don't want to die, or you don't want your employees to die from a disease that is killing a lot of these frontline workers and essential employees,
Mm-hmm.
including the people working at the Dollar Tree, at the grocery store, etc.
Yep.
You can put a sign on your window. You can decide as a business that nobody can come into your business unless they're wearing a mask and unless they use hand sanitizer. If they don't like it, they can vote with their feet, just like the man that says that he chooses not to wear a mask and he chooses not to go and patronize Costco because they told him he has to. He's just going to miss out on all the sweet deals at Costco. That's his loss.
Mm-hmm.
And let me just tell you that what I am seeing inspires fear. Look at this video from David Muir, Nightly News, World News Tonight, excuse me, of a Dollar Tree video where an employee, you can see her standing there kind of at the end of the aisle, is assaulted, I would say, by a patron after he is informed that he must wear a mask. This comes to us from ABC News. There she is. You can see the man coming around the corner, and he walks by her. She tells him, "Sir, you need to wear a mask." And he walks by her. Before he leaves, he walks over and he licks her on her skin. He wipes his nose on her sleeve, and he puts his bodily fluids on this woman. What kind of a sycophant, what kind of a sicko, what kind of a crazy person decides that because they were told they need to wear a mask in the store, they're going to go assault someone? What are your thoughts? What should happen to this man?
Oh, he should be arrested. I mean, there's a law. You know, people have been arrested for throwing their body fluid on other people is considered an assault. Especially, it actually started to surface during the AIDS epidemic. You know, they saw because there's this woman in Moorhead actually got arrested, and she spit at the officers, and they arrested her with this new law in North Dakota that you couldn't transfer your bodily fluids like a weapon. So I think that cops should have been called. He should have been hauled away.
I mean, can we agree that no one here is more valuable than other people, that no life is more valuable than another?
Mm-hmm.
The people that are working in these stores that are giving you, putting their lives at risk by running the cash registers at these places of business that offer you supplies that you need. And we can't even have the common courtesy of ensuring that they feel safe.
Yeah, really.
Don't they have a right to feel safe?
Mm-hmm. Yeah.
It's scary for them. They're watching their coworkers get sick. They're watching their coworkers die. They're watching as one person gets sick and the whole family ends up getting this thing.
Mm-hmm.
But you don't want to wear your mask inside of the Costco to make sure they feel safe? You don't deserve to go in there.
Yep.
You just don't deserve it. You don't deserve to go in there into the Costco if you don't want to do that. You have to follow the rules just like everyone else. Here is another aggressive and angry response to mask wearing. And this was in reply to one of these posts of a person saying, "I choose to wear a mask."
Okay.
This says, gosh, doesn't even register 0.01 there. Maybe all you chicken littles should wrap yourselves up in plastic wrap and leave the living to us that can take this among the millions of other viruses that are spread. It's idiots like you that will ruin the economy. So wear your protective mask that doesn't do beep, and maybe carry your blankie with you too to give you a sense of security, you clowns.
Yeah, wow.
That's
Pretty
so
hostile.
hostile.
Yep, definitely.
So hostile. And if you don't think that there is a trend, let me share a story with you from Oklahoma. In Oklahoma, the city of Oklahoma, in the state of Oklahoma, had to walk back an emergency declaration requiring customers to wear face masks inside businesses after threats of violence were hurled at store employees. Officials in Stillwater announced the change February, less than 24 hours after the rule had gone into effect at stores and restaurants. This is all part of their reopening preparedness response. Okay, when you go into these crowded places where you can't social distance per CDC guidelines, you got to put the mask on. You don't have to wear it in your car. You don't have to wear it outside of the store. You don't have to wear it while you're walking through the parking lot to get there, but you got to wear it inside. That's it. That's all that's being asked of you. And they couldn't even do that. This is what the request was from the city manager, Norman McNichol, in a statement. In the short time beginning May 1st, the face coverings have been required for entry into stores or restaurants. Store employees have been threatened with physical violence and showered with verbal abuse. In addition, there has been one threat of violence using a firearm. Somebody used terroristic threats against an employee of a restaurant or a store where the governor, the city manager had given orders, the mayor had given orders for everyone to wear masks. I knew there would be some sort of objections, said the mayor, but I didn't expect physical confrontations with employees and threatening phone calls to City Hall. I hate that our businesses and that their employees had to deal with this abuse today, and I apologize for putting them in that position. He said that face masks are still strongly recommended for residents when around other people, and he will continue to be required for workers at public-facing businesses. So the people that are working in these frontline positions, in the stores, in these restaurants, they are still required to wear the masks, even if the people shopping don't. And the mayor did tell everyone they still have the right to require people to wear masks in their store, even if the city has now walked back its emergency declaration to try to, ratchet back some of the violent response to this rule. And the saddest part of this all is that a lot of the people in the city believe that the rule made by the mayor is unconstitutional. This is, once again, lay people thinking that they know constitutional law, that they've studied the law, that they know more about the law than people that are lawyers, people that are judges, or people that in city government go to city managers and city attorneys to decide what they can and can't legally do or tell you to do. But you think you know more than the city managers and the city attorneys. This is what was stated in this article. McNichol said many of the people who objected to wearing the masks have the mistaken belief that the requirement is unconstitutional. He said it's upsetting that while people have the right to exercise their beliefs, they are also putting others at risk. The city manager pointed out that face masks and coverings are recommended by the Center for Disease Control and Prevention and the state's health department to prevent the spread of coronavirus.
Yeah.
Mary Martinez says because it's unconstitutional. Even Barr said. Barr, the state attorney, the attorney general, it is not unconstitutional for a city government or a state government to tell their people in the state that they have to follow CDC guidelines to protect the health and well-being of other people, especially when there's a deadly disease about. It's
Yeah.
not.
You're told to do all sorts of things,
We're told to
You're
do
told to
all
wear
sorts of
clothes,
things. Right.
It's your right to run around naked. No, it's not. It's a thing called indecent exposure. You'll get thrown in jail for it. There's all
But
sorts of...
it's more than that. This is a case of having a communicable disease and killing other people with it. Let me give you an example. AIDS. If you knew you had AIDS and purposely went out and had sex with other people and transmitted AIDS to them when it was a very, very deadly disease, you could go to jail for murder, attempted murder.
Yep.
And people did. People were prosecuted for going and getting other people sick when they knew that there was a deadly disease that they were giving out to other people.
Yeah.
So, yes, people can tell you not to kill others. You're not protected under the Constitution for your right to murder other people. Nothing in the Constitution protects people who murder other people. Okay? Nothing. Oklahoma had to end their mandatory mask thing because people weren't paying attention. Now, let me tell you something else that's even more disturbing. In LA County, and I will probably be bringing you this report, this interview, this individual that I spoke to that works in LA County, and this is the most disturbing part. They work for and with the Department of Health Services, the very same people that hire law enforcement personnel, hospital personnel, and the like for the city, for the county of Los Angeles, told an employee that had been in direct contact with someone that had tested positive for COVID-19 that they are not allowed to quarantine even though they show symptoms. Can you believe this? This is astounding to me. They know that these folks that work for the Department of Health Services are working in hospitals and working as frontline, like emergency responders, like EMTs and cops and things of that nature. Those people are the ones that are coming into direct contact with people that are contagious, people that are sick, people that have emergencies because of COVID-19. And yet, when one of their own is exposed to this deadly disease and begins to show symptoms of this deadly disease, they are denied the right to stay home and quarantine and ordered to return to work until they have been given a test, and that test comes back, which could take days or even a week, and it says it's positive or not. That's when they begin to quarantine. What? You're going to allow someone that's been in direct contact with someone that's tested positive with COVID and tell them they have to continue to work? This person has continued to work since learning of the fact that they were exposed to COVID. And let me just share with you, and they're going to be coming to talk to me. They're going to be giving me an exclusive interview. But they shared with me that the employee that gave them this, that exposed them to COVID, they don't yet know for sure if they have it, but that exposed them to COVID, had symptoms for a long time, was in self-denial because they didn't want to stop working, and even after testing positive for COVID, returned to work. It's unknown how many countless people in LA County's Department of Health Services have been exposed to COVID. This person knows of at least another worker that they work closely with, that worked closely with this person that was shedding the virus, that has COVID-19, that's also showing symptoms. Here's the letter they were sent from LA County. In this letter, as you can see at the very top, can you get to the very top so we can look at it? It says it's from the Los Angeles Health Services. You see that? LA County Health Services. And it's sent to their workforce member. You may have been exposed to someone who tested positive for COVID-19. If you're not having symptoms, there's no work restrictions. Unless you had direct contact with respiratory secretions from that coworker, you must wear a mask while working for 14 days. So, knowing you came into contact with someone that has tested positive for COVID, unless they spit in your mouth, unless they spit on you, if you didn't come into contact with their respiratory secretions, you're good to go. Get back to work. Just monitor your symptoms for the following 14 days. Now, if you have symptoms, then you have to stay home. Please stay home, it says. Seek the advice of a medical professional, okay? And inform us, your bosses, whether or not you have symptoms. Don't forget to do all of these things, which include cleaning your hands, wearing a mask, following social distancing, staying home as much as possible, maintaining 6 feet of separation, avoiding contact with others who are sick, covering your sneezes and coughs. And then at the bottom it says, return to your work is based on your symptoms and test results. Mm-hmm. Those two things are going to allow you to return to work or to have to be under quarantine. She also received this letter. This letter says that they are exposed, low risk exposure. You have a low risk exposure. Dear so-and-so, we've learned you may have had exposure to someone who was confirmed to have coronavirus. To our understanding, while you were exposed to that individual, we have no reason to believe that you had close contact with that individual. Well, the individual does know whether or not they had close contact with the person that tested positive, because it wasn't too difficult to figure out who it was. And they did have close, prolonged contact with the individual. But this letter, if you read how it reads, Duke, it's assuming, it's kind of sending this vibe that, hey, even though you have come into direct contact with someone that is tested positive for COVID, that doesn't necessarily mean you got it.
Which I really minimizes it.
You could totally not have it, and you definitely should come back to work. Let's go on and see what else it says, because this is the vibe I'm getting. If I am reading into this in a way you don't believe is true, let me know your thoughts. Right. Here's what it says. First and foremost, we want you to make sure that you monitor your health. So once again, follow CDC guidelines, observe your health for 14 days. That doesn't mean you have to quarantine. Why would you tell someone that's been in direct contact with someone that had COVID positive? This is like almost the opposite of what I have heard that you should do if you come into contact with someone that's been COVID positive. Hell, if you went to a city that was a hotspot and then returned to your state, you were told to quarantine. Yep. Just for being in a city that was a hotspot. Yep. You come into direct contact with somebody that tests positive and you're told, oh, don't quarantine. By no means should you quarantine yourself. What? Were you prepared to see this? This is in LA County where there are people protesting because they can't go to the beach, where you have people getting arrested because they're not social distancing, but the Department of Health Services that hires first responders and healthcare workers is sending them back, even when they've tested positive, even when they've come into contact with someone that tested positive. Let's keep looking. Then it says, this does not mean to quarantine yourself. It does mean take your temperature on a daily basis, confirm you don't develop signs, have upper respiratory infection. Please make sure to keep your manager appraised. In the event you do develop a temperature or do develop signs of upper respiratory infection that can manifest in shortness of breath or cough, contact your health provider immediately. Well, guess what happened? They developed symptoms, fever, nausea, and guess what? Cough and shortness of breath. So they contacted their healthcare provider, who told them, you have been exposed to COVID-19. You should be in quarantine, monitoring your health in quarantine because you've now shown early signs of COVID, and gave her a letter saying, so-and-so has been exposed to COVID. At this time, I recommend they monitor symptoms at home for 2 weeks. So they're not supposed to go to work until May 14 if they don't develop symptoms. Should they develop symptoms, they're to schedule an appointment to get a test for COVID-19. Guess what? They developed fever symptoms. That was the next slide. It said fever symptoms.
Okay.
Guess what? They developed fever symptoms. They documented that they developed the symptoms and the shortness of breath. They contacted their employer. They told them, I've done all of the things that the letters you gave me and the instructions I received gave me. I will be getting a test on Monday, which is today, May 4th. And they said, you have to keep working. You have to keep working until the test results come back. How do you feel about this, folks?
Wow.
How do you feel knowing that this person was in direct contact with someone that has tested positive, a person who I told you, by the way, didn't want to stop working, didn't want people to find out they were COVID positive. They almost certainly knew that they were positive for COVID and were terrified for anyone to find out. When they were so obviously sick that they couldn't hide it anymore, they were ordered to go get a test. And even after they took the test and were positive, they came back to work. That's how much viral load this person was shedding at their job and infecting their coworkers with. And that person is now in quarantine. But the person I talked to can't quarantine.
No, let's go back into work.
They're going to be forced at some point to take their sick days, to use their own sick days in order to avoid going to their jobs and infecting other vulnerable people, which could include, in this case, because they work for the Department of Health Services, people in hospitals, vulnerable people, victims of COVID themselves, or sick from something that looks like COVID. Duke, your thoughts?
Well, I think it's like it's going to be happening, and if this is a high level organization that's supposed to be really monitoring this and frontline workers, the stuff's going to happen almost everywhere. You know, it's just you're lifting the curtain a little bit to see what's underneath. This is what's going to happen in the packing plants, the meat packing plants, the industries, the factories, because people don't want to shut down. They're losing money, and they're being totally exploiting the people that work for them. And plus, it really makes me mad that they're putting so many people at risk for their motivation of just keeping the doors open.
A lot of people in the comments are telling me they've gone to a number of different places to shop, Costco, Safeway, Sam's Club, Walmart, Home Depot, and very few workers are wearing their masks. And if that, and the fact that there are people violently reacting to being told to wear masks doesn't tell you what kind of a disaster we are in for in the next week, 2 weeks, in the following months, because of this hasty and poorly planned out reopening that isn't protecting people in the process. I don't know what will, because that to me tells me everything I need to know. Take a look at this video that shows you how far that vapor that you breathe, when you speak, when you talk, when you cough, when you sneeze, when you're just breathing air in and out, how far it can go. This is why you need to wear masks. Here we go.
How far the droplets travel. They fill the air, visible with the green laser light, simulating what happens when we cough.
It generates particles on the order of 10 to 20 microns, which is roughly close to what the smallest droplet sizes are when we cough.
Take note how quickly the simulated respiratory droplets spread.
1.
The droplets expelled traveled a distance of 3 feet almost immediately. Within 5 seconds, the droplets were at 6 feet, then 9 feet in just about 10 seconds. Remember, 9 feet is 3 feet beyond the recommended social distancing guidelines.
Already reaching roughly 9 feet now. It's still moving farther slowly.
The fog of droplets lingered in the air, but kept moving forward, taking just another 30 to 40 seconds to float another 3 feet.
It's getting closer to 12 feet now.
Yes, he said 12 feet. Over and over again, the simulated droplets blew past the 6-foot mark, often doubling that distance.
Okay, it has passed 3 feet already, approaching 6 feet. And it looks like it has crossed 6 feet. And now it has slowed down.
How long might they linger at 9 feet and 12 feet?
So at 9 feet.
Do you see how far that can travel?
Yeah.
I mean, if that, it obviously we don't have everything in place to keep people safe from contracting this virus. And we're not using all of the tools available to us because reinfection or not being completely cured is an issue. I brought this story to you a while back, told you that in South Korea, they were testing people and they were showing that they still had the virus a month or so after. And we found that they believed that people weren't actually getting reinfected, but that they were still shedding virus even after they had been considered recovered under their own guidelines.
You know, and it's really hard because we don't know. You know, we're having to learn as we go with this virus. Has not been around. So all the solutions we're coming up with in the study of what it is and how it does, how it's transferred, are things we're learning every day. So everything's changing. You know, and it's like that video reminds me of when you have a vape pen and you're vaping.
Yeah.
And you exhale vape, which is vapor, and it lingers in the air. You know, and it flies, and it just keeps on going. You're listening to KPPP LP 88.1, Fargo Moorhead, adding local color to your airways.
I wanted to share some of the comments that we've gotten. Kat Wright tells us that there's a Walmart where she lives where they shut it down after 40 people tested positive. Are those employees? Kat, let us know. And what state is that in? I would love to hear. Also, if you're one of these employees that is being given the runaround, put in danger, or being told, even if you're showing symptoms of COVID, you have to go back to work and possibly reinfect other employees, let me know about it. One of the comments from our YouTube viewers is that Trauma Mama 3 says, in response to what I stated about how people are going back to work even when they've been tested positive or shown signs of infection, she says that if we did that, we would have everyone sick at the same time. All of our healthcare workers would be out sick at the same time. What do you think about that, Duke?
I don't get it. It's like people get sick. It's staggered. You know, if someone's sick, they encounter another person, they get sick, they spread it to other people. It has an incubation period from 2 to 14 days. That's not even definite. It can hit you right away. It can not hit you for quite a long time, and you're carrying it around before you actually get infected by it. So it's like I'm not quite clear what the comment meant. I'm sorry.
Well, that if people were quarantined because they came into contact with someone that had COVID at their job, then everyone would have to be quarantined at the same time. Here's the thing, though. I am well aware that there are different standards for hospital workers and nurses. The CDC has stated that those people that are caring for folks inside of the hospital setting, where they're going to be exposed to a very high viral load and more likely to contract the illness than almost anybody else, except for maybe first responders, EMTs, etc., ambulance drivers, etc., that those folks are allowed to work if they're infected because of their use of all of the PPE that's required in emergency rooms, which includes a gown, the visor, all of that stuff. And we don't have that. We don't have that for the people working at the Costco. We don't have that. And for a lot of the people that are working in these jobs, they just don't have those protections. I feel that it's a little bit different.
Yeah.
Duke, your thoughts?
What is, it's like when a person has a virus, the mask, there's been such a debate about the mask, but the N95 mask, actually, you have the virus, you wear that mask, you're not going to spread it. You're not going to get it either. A cloth mask, you're not going to spread it, but you could get it. It's like it's not effective. So if you're working with the virus in your close proximity, because those people are, they're chances are they're going to get infected. It's just impossible to work day in, day out and not have, some of those droplets enter your system, and plus they don't have the equipment to be able to change it out. They've had to like reuse stuff and figure out ways to sterilize masks to the point where they degrade. So there's some pretty big holes in keeping people safe, but they have to keep on working. I mean, it's like if they weren't working, if there was no nurses, no doctors, people would be dying that could be saved.
Exactly. People that could be safe.
Yes.
I wanted to share with you that we have reinfection in the feces. We actually see that it stays for people for a much longer time. The World Health Organization says that we don't actually have enough evidence to understand if and or why some people may experience reactivation or still be shedding virus after they're recovered, quote unquote. That we need more data to determine this and why the virus may be flaring up in some infected people. But we may discover that it's all tied back to the functionality of each person's immune system, and each person's immune system reacts differently depending on their history, their background, their comorbidities. What they have found, though, and this is something that we've talked about in the past, is that the virus, even after people test negative, more than one time, in fact, through a nose or mouth swab, they are still holding and shedding virus in their lower lungs, in their intestines, and in their feces.
Oh, wow.
Yeah. Here's what it says in Healthline. Being, people being discharged with the virus still in them, and then the disease returns. Well, not so much that they return, maybe that it's always been there, and those people are going home. This is true of people that are being released back to nursing homes. This is true of people that are being released from hospitals. They could still be shedding the virus in their stool, for up to 33 days after the initial infection. Okay, folks?
Wow.
So what they're saying is what we really need to be doing is fecal swabs. Fecal swabs would help us to actually have a more accurate understanding of whether or not someone is completely done with the COVID virus. They're not shedding virus anymore. By the way, using public restrooms right now, not the best thing. Sharing restrooms with someone that's asymptomatic or positive for COVID, is very dangerous because, again, they're still shedding it in their stools. So once a negative from a fecal swab is produced, then you definitely have more clarity that this person cannot continue to infect people. Which brings us back to a story I brought you a month ago or longer, which is that wastewater in different cities can be tested and help identify very, very precisely who and how many people have the virus.
Wow.
And in this updated report on this topic, it says that as the country is scrambling for ways to quickly expand its coronavirus testing in communities, scientists are turning to the sewers for answers. This researcher named Halden says his team can detect COVID-19 hotspots in wastewater in a matter of hours, Duke, not days.
Wow.
Hours. Yeah. And the system identifies microscopic evidence of the virus, and it is so sensitive, it can detect a single carrier of the disease in a population of as many as 2 million. That's how precise this test is. It is a valuable tool, he told us, with diseases like coronavirus, where so many carriers are asymptomatic. They can even identify within a city, down to hotspots in what neighborhoods, down to the block, down to the building that the virus was shed from.
Wow.
In the wastewater. And this is something that we should be, I don't know why we haven't already done this. This is a very quick way of making an assessment. We could take the blinders off in city after city, municipality after municipality, and state after state across this beautiful country and know what we're dealing with if we treated our wastewater and did these tests to check to see how many people in our community are actually sick with the virus.
Wow.
Wouldn't that be eye-opening if we could really know that number?
Yeah, it sounds effective.
Not in a matter of weeks, not in a matter of days like it takes this test currently, but in a matter of hours. And this is something that can be scaled up. There is only one research facility currently in this one particular city, but this could be happening in every wastewater treatment plant in every place in America. And in this Newsweek article, we also learned that it isn't just Maryland that had to hide its tests from South Korea so that they could test the people in their state. Also, Colorado had purchased 100,000 COVID tests from South Korea and had to keep it a secret. Governor Jared Polis did not announce that the state recently received over 100,000 coronavirus tests from South Korea over the fears that federal authorities would seize them. Multiple instances of federal seizures of state supplies of tests and protective equipment have been reported since the pandemic began. Governor Polis said on Friday that Colorado kept their latest shipment hidden because the state didn't want to lose the test to the competition. The competition is other states and our federal government. This is a quote from the governor to public radio. We kept it under wraps. We simply didn't know if anybody would swoop in. I mean, we didn't want another state or the feds or anybody. We don't want to give the competition, which would mean other countries, could mean our own country, could mean our other states. We don't want to give them a heads up of what we're doing. Maryland Governor Larry Hogan had members of the National Guard and state police guarding the 500,000 tests that he procured for his state of Maryland in an undisclosed location. Now Colorado is following suit. How do you all feel about the fact that in our country, we have state governors employing National Guardsmen to guard tests that we're procuring from across the globe so we can actually find out who's sick and who isn't? We still don't have the tests for our frontline essential workers. I just showed you that one of those people working in LA County, even after coming into contact with COVID, isn't being allowed to quarantine. Do you feel safer now?
No.
But as I said, people's right to make others sick, people's right to live in ignorant bliss, to not know if they have COVID, to not find out, to not want to know if they have COVID, to be able to have COVID and shed it and make others sick because they want to, because it is their constitutional right in their head to go out and make others sick and not get tested and refuse masks and refuse testing if they want, is something that is rampant in our country that will continue to hinder efforts to track people that have it, to quarantine them, to make them keep their distance from others. And even more so, there is a concern about privacy. Apps, including those being developed by Google and other companies, and Apple, for example, are probably not going to be all that well received, since many people have a fear of privacy and tracking by the government. Point of View at KVLY posted this concern by Senator Josh Hawley about the COVID tracking apps. Would you read that one for us, Duke?
Yeah, despite a commitment to anonymize data, Hawley, this is Senator Josh Hawley, said that data could be re-identified by comparing it with another data set. Pairing the data being collected with the GPS data and Wi-Fi positioning, that data would generally erode privacy by making precise surveillance much easier. Google and Apple earlier announced a joint project to use phone signals to track people so they can be warned they've come into contact with someone who's tested positive for the coronavirus. The project will start in May and will see the two companies build the contact tracing capability into both iOS and Android. Yeah, we brought this up before because in China they actually did this, and we showed on the subway how people could actually see where they were. That the subway car they were in had someone who was positive, and they could trace where they went and how they had contact with other people. And, of course, you think about the privacy, but we're trying to stop the spread of this. We're trying to warn you. If you had contact, wouldn't you want to know it? But, people fall back into that, like, we need our privacy because it's going to be abused. It's hard to abuse it if you're going to die.
Here's the thing that people have been hanging their hat on with regard to whether or not we're ready to open up our economies. And that is, the piling up of bodies and refrigerator trucks sitting outside of hospitals and these field hospitals and the parks and, in tents and parking lots and all of that. That's, starting to get ratcheted back. They don't have this, bodies piling up in hallways waiting to get on ventilators in hospitals in New York. They have the PPE they need. They've got all of the stuff that they need. So we're good, right? We can go ahead and start reopening certain sectors of business and ratcheting up the illness, knowing there are going to be hot spots, knowing more people are going to get sick. But what's really happening, folks, is quite alarming, because there are still places, even in New York, where things have, for the most part, gotten under control, where people are not getting the care they need. Here is a desperate plea from a New York nurse. A New York nurse, by the way, speaking on behalf of one of the frontline responders working in New York who could not speak for fear of reprisals. So this is her friend speaking on her behalf, sharing her story.
I'm sure I'm going to get some hate messages after this. Frankly, I don't care, because this could save someone's life. I'm a nurse practitioner. I am licensed and certified. I am not on the front lines. I have a friend in New York City who's on the front lines. And for her safety, she cannot come out and say these things. So I am her voice. I'm not going to name names of people or hospitals for the safety of those involved. But this is her account, okay? I am her voice here. I'm going to tell you what she has told me. She wants this to get out. Now, I'm sure this is not the case everywhere. I'm confident. I have friends that are in other places. They're on the front lines. They're in ICU. And it's not like this everywhere. But in New York City right now, in some of the hospitals, this is what is going on. People are sick, but they don't have to stay sick. They are killing them. They are not helping them. She used the word murder, coming from a nurse who went to New York City expecting to help. Patients are left to rot and die. Her words. She has never seen so much neglect. No one cares. They are cold and they don't care anymore. It's the blind leading the blind. Now, a couple of weeks ago, I was on with some nurse friends of mine and we were discussing different medications that could be used to potentially help people. Doctors who were reporting around the country that they were using a combination of medications that were helping people. People were not dying when they were on these medications. They were getting better. Those medications are not being used in hospitals in New York City. What is happening is that they're putting people on nasal cannula. If they require more than 6 liters of nasal cannula, they get intubated, they go on the vent, or they get trached if there's not enough vents. They don't get high flow, no non-rebreather, no non-invasive ventilation, no CPAP, no BiPAP. They're on a closed system, the ventilator, versus a CPAP or a BiPAP for fear that it will spread the virus. Which, by the way, I know a nurse in Florida who was fired for exposing that about CPAP and BiPAP and patients being put on the ventilator, like straight away to the ventilator, to be on a closed system. The patients don't know any better. They don't have family with them. There is no one there with them to advocate for them. So they are scared and they give consent. The ventilators have high PEEP, high pressure, which then causes barotrauma. It causes trauma to the lungs. Dr. Siddell, Cameron Kyle Siddell, a few weeks ago, put out a video. He's in New York City, and he put out a video saying something is not right, like we're not treating this correctly. We're doing something wrong. This doesn't make sense. They pulled his video from YouTube and they took him out of ICU because they couldn't have one doctor going against the grain, going against their protocol. The protocol is propofol or some kind of sedation because they're on the ventilator, and IV antibiotics. There's no hydroxychloroquine. They're not using that combination with Zithromax. They're not using zinc, vitamin C, high doses of vitamins A and D. They laugh. This is what she's told me. They laugh at that. She says, this is a nightmare. It's out of a horror movie, and I don't want to be a part of this. There are people who are a full code, and yet, if they crash, they're not doing compressions because it will spread the virus. Full code, not doing compressions. Family is not there. They have no one to answer to. No one is being held accountable. A code was called and no one came. So sometimes they're not even resuscitating people. Again, left to rot and die. They're not given blood because we know that the blood is not oxygenated in these COVID patients. We know that. There are doctors all around the world sounding the alarms. These are the drugs that work. This is the pathophysiology of the disease. This is what's happening. And for some reason, it's not changing. Even though we know, some of us know what's going on, nothing is changing on the front lines. They stay in the same PPE all shift, except for the top pair of gloves. So 2 pairs of gloves, or I don't know, maybe more than 2, but they're only changing the gloves on the outside. Gown, mask, whatever else stays the same because all patients are COVID patients. So if it's a COVID floor, it's all COVID, but it's not because some of them are rule out COVID. So even if they're rule out COVID and they're not COVID, they're gonna get COVID because they're using the same PPE all shift and they're carrying that contamination to all of the patients. They're not changing their PPE. They're not going into rooms. So they're running long tubing into the room so that they can manage the tubing from outside of the rooms. So if they're not going into the rooms, that means they're not assessing the patients. Okay, this is coming from my friend who is in New York City right now on assignment, who went there to help, and this is what she's finding. It's a horror movie, she says. Not because of the disease, but because of the way it's being handled. She said we need help, and people are sitting there waiting in the hotels. Money, I guess, it's being paid for by FEMA. And yet they're still understaffed. And there are hundreds of people, hundreds of nurses in the hotels waiting to be called onto a shift. I'm really fortunate. I don't have any family in New York City that I personally have to worry about. If there are people that you are worried about, or maybe it's not even New York City, maybe you're in another city that's being really hard hit and you're just hearing really bad things coming out of that city, something is wrong in the system. So go against the grain. Request records immediately. Records, transcripts, immediately. Do not give consent for intubation if you don't want to be intubated or your loved one to be intubated. Demand non-invasive or less invasive ventilation methods. From my nurse friend who's in New York City right now on assignment, this is murder, she says. People are being murdered and no one cares. Horrible care.
Demand therapy. Demand intervention. Demand care before you get to the point where your blood oxygen level is below 90 and you have to be on the road to intubation or you have to be intubated. Demand something for your loved ones, including tests, before you get to that point. And if you don't believe that this coronavirus is even real, if you don't think it's that serious, if you believe it's real and don't think enough people are going to get sick and die from it such that you should care or change the way you live in order to respond to it, or if you are a person that is worried sick, that is afraid of what's going to happen to your loved one, your family member, your elderly family member with an underlying condition, I pray for all of you equally to get the care that you deserve, to not be abandoned alone, to not end up being put on a machine when you don't need to be able to receive the best care, the best medication so that you can survive. I pray that for you. I pray it for every member of your family should you catch this disease, even if you don't believe in it, even if you don't think it's serious. I pray that every single person that you care about has access to a test. I pray that every person that you love that is sitting in a nursing home has a nursing home setting where all of the employees have been tested for your peace of mind and the peace of mind of the residents living there. I pray that you have access to information about how many people are sick in your community through wastewater testing or some other form of contact testing or trace testing or mass testing so that you can feel more secure about going back to your normal life, going to the gym, going shopping, maybe even someday going to a big football game in a stadium or a concert. I hope that your workers in your community, the employees in your family, are going to be able to get tested and have CDC guidelines observed in their place of business so that they don't feel afraid of coming home every day and making everyone else in their family sick. I pray that your state has access to tests that they didn't have to buy clandestinely in South Korea or North Korea and have them hidden in a warehouse protected by the National Guard. I hope that there is plentiful PPE for your workers and for your frontline first responders and healthcare workers in your state. And even as I pray for all of those things for you, I know they don't exist. Not in the abundance, not in the way they're supposed to. And that's why I am afraid for our country. That's why I'm scared for all of these reopenings. New indications from Yahoo Finance show that reopening states will cause, by projection of the models in this article, will cause 233,000 more deaths. Not more contractions of the illness, more deaths. 250,000 people dead, more than what we have. not 60,000, not 100,000, but on top of the 100,000 that we're going to reach real soon here, you can add another 233,000 people dead. And that's very disturbing, especially when you start to consider, as you look from state to state in Louisiana, in Illinois, in Michigan, and in many other states that are now looking at the disparities between those who are contracting, getting seriously ill, and need to be hospitalized from this disease, and especially the percentage of those dying. And most of those people that are dying and getting very seriously ill are black and brown, are working class poor, are the types of people working, for example, in the meatpacking industry. And here is, what people of color deaths are starting to pop up everywhere throughout the country. And this has been acknowledged by the president, by his staff, by different governors of states. In Chicago, for example, more than half of the people tested positive, and nearly 60% of those who have died are African Americans, and they make up less than 1/3 of the city's population. Similar rates are playing out all across the countries, all across the country. And let me just say this. Dr. Fauci and a lot of other people have said that we're looking into this, we're studying it, we're going to pay real close attention to it, and we're going to make sure that we respond to it. Well, we don't need to wait weeks or months. We don't need to do studies. If you know that the people that are dying are disproportionately black or brown, you need to take steps to protect those people as being more vulnerable to dying from this disease. Unless you decide that black and brown populations aren't as important. One of the cornerstones of this administration's selling points to minority populations is what this president did for the economic status of black and brown people in this country. He lifted people out of poverty and unemployment in ways that no other president had ever done. And now, as we are going into re-election, he may be one of the presidents that sends most of a higher percentage of black and brown people to die in their jobs, in the pursuit of executing their jobs. And that's not going to be good for his re-election campaign. That's not going to be good for this country. And it's not going to be good for the economy. Getting more people sick is not going to be good for the economy. What protects people, their health, their well-being, is going to protect the economy, because going forward, people having faith in being able to go back to shopping, back to life as they knew it, is going to depend a lot on what businesses are doing and what the folks in our communities are doing to make sure we feel it's safe to go out there. As long as there are yahoos licking workers at stores because they don't like being told to wear masks, I will be staying home. Mm-hmm. And I'm sure there are a lot of people out there that do not want to deal with that nonsense that agree with me, and they will vote with their wallets as well. If I go to an establishment and I see that the most of the people that are working there aren't wearing their masks, they don't want my money. If I go to a restaurant and I see most of the people there not socially distancing and not wearing masks, I won't go there either. Mm-hmm. I don't want to take the risk with my life that some other people are willing to take. And that's my right. And it's your right, too. And before I go, I want to give you something to take your mind off of all of the doom and the gloom. And I found the perfect video. This is a father and daughter team on TikTok. This is some of the skills they acquire. You know how people are acquiring skills and learning dance steps and all of this. This little girl looks like she might be 5, 6, 7 years old. I'm just impressed with what their skills are. Take a look for yourselves.
Deep breath. Relax, baby. Love you. Let's go. Say, let's go beast mode. Ready? And let's get it. Hit this one. 1, 2.
It's in slow
Slow-mo.
motion.
He
He's
flings
tossing
in the
her
air.
up. She's going to the second floor. And
Good.
right
Just
on her
grab.
feet.
And then she
Good.
lifts up her little leg.
Wow, that's great.
There you go.
Like a cheerleader.
Spin
Yep.
it like those.
It is cheerleading
Basket.
moves. Yep.
And then
Good.
up she
Opposite
goes.
limbs. Ready?
Oh, wow.
Tick-tock. Good.
Look at her switching feet.
Good
Wow.
Yeah, you did it, girl. You killed it.
Daddy.
Uh-huh.
Are you impressed with her skills?
Very much, very
what
much.
a cutie pie is she. I love that video. Send me your videos of all of the new skills you have acquired, whether it's gardening, knitting, whatever it is. Make sure it's safe for the work environment, of course. But let me know, what skills have you learned during the pandemic? Well, that's all I have for you this evening here on A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You've been listening to 88.1 FM, KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. Have a good night, and God bless.